Disaster Triage Nursing NCLEX questions. You're working as a triage nurse during a disaster situation. Based on the triage color code tags placed on each of the wounded, which tag color represents the wounded who have the highest priority of being treated first? See red. Red. The red tag indicates the patient must be seen first because they have life-threatening injuries, but could survive if treated quickly. The patient is still alive, but there is a severe alteration in their breathing, circulation, or mental status that requires immediate medical attention. A catastrophic disaster has occurred 5 miles from the hospital you are working in. The hospital's disaster plan is activated and the wounded are brought to the hospital. You're helping triage the survivors. One of the wounded is able to walk around and has minor lacerations on the arms, hands, chest, and legs. You would place what color tag on this survivor? Green tags are for patients who have minor injuries. If the patient can walk around, they are tagged as green. Sometimes they are referred to as the walking wounded. Which statement below is incorrect about the yellow triage tag color in regards to a disaster situation? A survivor with this tag color is seen after patients with the green tag color. A survivor with this tag color can have treatment delayed for an hour or less. A survivor with this tag color has serious injuries that could eventually lead to the compromise of breathing, circulation, or mental status, especially if treatment is delayed more than an hour or so. A survivor with this tag color has second priority for treatment of injuries. This statement is incorrect. It should say, a survivor with this tag color is seen after patients with the red, not green, tag color. For the next 7 questions, use the START method for adults to help triage the wounded that have been involved in a disaster situation. Each question will give you details on what you have assessed, and you will need to use those details to help you assign a color tag to the individual. The wounded victim is unable to walk, has respiratory rate of 40, capillary refill is 6 seconds, and can't follow simple commands. The wounded victim is assigned what tag color? While triaging the wounded from a disaster, you note that one of the wounded is not breathing, radial pulse is absent, capillary refill greater than 2 seconds, and does not respond to your commands. What color tag is assigned? Black. The black tag is placed on the wounded that are dying or have expired. The injuries are so severe that death is imminent. There is severe alteration or absence of breathing, circulation, and neurostatus. The wounded victim is unable to walk, has respiratory rate of 12, capillary refill is 8 seconds, and is unresponsive. The wounded victim is assigned what tag color? The wounded victim is unable to walk, has respiratory rate of 19, capillary refill of 1 second, and is able to obey your commands. The wounded victim is assigned what tag color? The wounded victim is unable to walk, respiratory rate is absent, but when airway is repositioned, breathing is noted. The wounded victim is assigned what tag color? The wounded victim is unable to walk, respiratory rate is absent and when airway is repositioned, breathing is still absent. The wounded victim is assigned what tag color? The wounded victim is able to walk and obey commands. The wounded victim is assigned what tag color? A. Green.